Just a few days ago, this 40-year-old hospital hardly resembled a health facility. It was dilapidated and then further damaged by the typhoon.
This is a mission of hope, to instill self-esteem in the people, because they said the world forgot them, nobody cared for them, nobody came for them, and we can see in the reaction from every civilian, from the mayor, even the congresswoman came from the Philippines to the island to say thank you. And the words they use, that this is the greatest thing that ever happened to Palompan.
When villagers heard South African medics were in town, the hospital was inundated.
Fine, don't worry, okay?
This Cape Town dentist has been a busy man.
Unfortunately, I don't think there's much access to dental treatment, or maybe there's just poor education and patients are not aware of the treatment that they can get. So things are just left quite a bit.
Surgeons have operated on a number of patients. A 7-year-old boy is in the emergency room. He's just been in a motorcycle accident. He sustained head injuries and he can't be airlifted to another hospital because there's no helipad. It's a country of 95 million people and limited resources to give quality health care. Locals appreciate the little the South Africans have done. For them, it means a lot. Janji Chauke, SABC News, Philippines.
Welcome back to Philippines Uncut. I'm your host, Buddy Kunana. Tonight's topic is the aftermath of Super Typhoon Yolanda. And joining us tonight, we've said goodbye to Mrs. Dita Stan and Mrs. Ina Yulo of the Ina Foundation, but we're now joined by Dr. Butch Ong and of Rescue 926 and Philippine Coast Guard Auxiliary, and also Dr. Titing Brillantes, also of Ina Foundation. Now, that video you watched earlier was actually a video taken from South African Broadcasting Corporation's clip of the work that Dr. Ong has done, his group has done in Leyte together with the South African volunteers who came all the way here from Cape Town and Johannesburg to help us in Leyte. So welcome back, Dr. Ong. You've been here before, so welcome back. And for the first time in Philippines Uncut, welcome Dr. Brillantes.
Hello.
Pleasure to have you guys here tonight.
Thank you for having us.
Let's start with some introductions, starting with Dr. Brillantes. Tell us a bit about yourself.
Yeah, I am Dr. Maria Teresita Brillantes. They call me Titing for short. In the Ina Foundation, I am a practicing dentist.
Yes. And how long have you been with the Ina Foundation?
I joined the Ina in 2008.
Okay. And you were together with Mrs. Yulo and Mrs. Stan in Leyte
Yes.
for the visit for the grief mentoring.
Yes, yes.
Excellent. We're going to get back to that in a few minutes. Now, Dr. Ong, for those who's only watching you tonight for the first time, tell us a bit about yourself. Tell us a bit about what you did in Leyte with the South Africans.
Yeah, they call me Doc Butch. I'm a sports medicine rehab practitioner, and I also specialize in disaster medicine. I have been doing search and rescue, disaster education for the last 20 years. And the most recent, of course, is our mission in Palompan, Leyte, after Yolanda, wherein we had with us, fortunately, the Gift to Givers Foundation of South Africa. And as you've seen in your clipping, we helped rehabilitate the Palompan General Hospital. We did medical missions in 20 barangays. We stayed there for almost half a month doing rehabilitation and recovery work.
Yes. And okay, let's talk about that. So you guys are really involved in the physical rehabilitation, treating people for illnesses and all that. Now, maybe you could describe for us what was your impression of Palompan or of Leyte when you first arrived there in the province?
Of course, because of the media, we were expecting a lot of fatalities before going there. So we had with us a lot of medicines, a lot of trauma equipment, and rescue equipment. But when we arrived, we were surprised that there were only 9 fatalities, seven or 9, out of around 70,000
very good
population of Palompan. And it's credited actually to the LGU of Palompan. They were really ready for the typhoon, and they had the fortunate natural barrier we call the
which Tacloban didn't have. The marsh.
They had mangroves protecting the city from the storm surge. Yeah. So the only ones who who died were those who were exposed, those who did not heed the warnings, and those who lived in the mountains.
So basically, this storm surge, just I'll say it now, people will keep talking about storm surge, but actually what happened was a virtual tsunami,
It was a virtual tsunami.
which
Yes.
hit Tacloban. That's why Tacloban was really
That's
devastated almost completely.
Yes.
But Palampon was spared because of the mangroves.
But when we got there, we did our medical mission. Well, we saw a lot of trauma, a lot of physical cuts, wounds, abrasions, and we visited the elementary schools of different barangays, and the children actually, most of them said that they didn't want to go to school anymore because their schools were destroyed. What for? You know? So at that point, I had the inkling that they were depressed already. So I wanted to do some post-traumatic stress debriefing. However, I did not have my team, who were social workers, with me at that time.
You guys were really there for the
medical
mission.
Yeah.
Kaya naman po, Dr. Brillantes, I understand, so you joined you were among the INA Foundation members who were who went to Leyte to do grief mentoring. What was your impression when you first reached Tacloban?
Oh, it was like very heavy, depressed, but you know, on the 6th week when we went there, unlike the ones I saw on TV, it was like technically brown lahat ng puno, yung soil brown lahat. But then when we reached there,
Na-uproot ho, siguro lahat ng the foliage, the trees fallen, yeah.
When we reached there, meron ng parang umuusbong na green. May grass na green, may makikita kang green. So parang there is hope. I mean, there is hope.
Okay.
We can overcome.
Yes.
Yun.
But then, okay, so you arrived in Tacloban, and then how did you get in contact with the people that you end up mentoring? How did you find them? What was your experience like?
We went around, and then the congressman met us, and then he put us in a bus. We went to Palo. Aside from the rest of the other visits, we went to Palo, and in there was a school, an evacuation center, and there we met mothers, which I was very privileged to talk to. And then what we did was like, we listened. The first thing there is to make them talk. If they can talk about their sadness, their pain, it is one step ahead already.
Sometimes, correct me if I'm wrong, in a situation like that, maybe you don't want to talk about it. You don't want to, the last thing you want to do is talk about
If they talk about it, it's one step forward already. So you don't talk about yourself, you make them talk. So automatically, I made myself clear that I lost also a child, and I experienced the same pain they do. You don't need even to ask them anymore. You just start saying, "Oh, ikaw, what's your story?" And they will go on.
Once they feel that comfort with you, and they feel like you're someone who understands them, who can feel what they're feeling, no?
Yes.
Butch, ikaw, you're an expert already in disaster management. You've been through, I don't know how many disasters in your 20 years as a Coast Guard auxiliary member, an officer. How important is this kind of work? Because, I mean, okay, when you guys went to Palampon with the Gift of the Givers, it really was for a medical mission to address the sick, the wounded, the injured, the ill, no?
Yes.
And to rebuild the hospital, the school. But how important is this? Because, a lot of people, when they talk about rehab, parang this aspect is somehow, correct me if I'm wrong, it is a bit neglected or overlooked. Not neglected, overlooked. What do you have to say about that?
What I can say really is for the children. When we go into a disaster zone, we immediately try to go into the public school system for us to be able to talk to the principal, talk to the teachers, and perhaps see the children. Why? Because children are really the most vulnerable population. They cannot express themselves as well as the adults do. When the psychologists or the social workers say, "Let's talk about it," adults can talk about it. Sometimes the children, they have a barrier. They don't want to talk
about it. They keep to themselves, and it
Yeah.
just festers there, no? And there's no outlet.
And then it becomes a turning point or a definitive point in their lives.
For sure.
And it might not manifest in the next few years, but when they hit probably teenage years or young adulthood, The depression, drugs, these things could be a coping mechanism, a negative coping mechanism for the children because of an unprocessed, we call it, unprocessed grief.
Trauma.
Or trauma.
Personal trauma.
Yes.
But see, this is why I think the work of INA Foundation is so important because, like, okay, without these support groups coming in, who does the child have to turn to for support, for solace? It's principally, I mean, the
Yes.
mother.
Yes.
And so, I mean, what do you have to say about the work INA Foundation is doing? Because they actually are focusing on the moms. Because as they mentioned, as Mrs. Yulo mentioned earlier, the mom is actually the rock upon which the family is built on. The moment that rock is, for some reason, psychologically, emotionally unstable, then like a deck of cards, the rest will follow, no?
I actually laud them for their work because as we know sa Pilipinas, ang ilaw ng tahanan. Kung ang ilaw ay di ba,
Madilim,
very
o
dim,
napundi, oh.
and then the family has no direction.
Yes,
The
I
family
agree.
can no longer function. Even the husband, hindi siya
Correct.
mag-function, no?
Correct.
So to begin really with the rehabilitation of a city, does not begin really with building roads, building buildings.
It's getting the people back on track, no?
Begins with a unit, the basic unit of society, which is the
The
family.
family.
And
Very
sinong
nice,
ilaw
very
ng
good.
tahanan?
Yung nanay.
The mother.
Now, kayo po, Dr. Brillantes, are there other groups doing this, focusing on mothers, on grief mentoring for mothers and helping them, get back on their feet and, normalizing their lives after trauma like this?
I haven't heard of any group yet. Maybe there are, but I have not encountered
Yes.
any group yet.
Yes.
So I'd like to, I really would like to go back to Tacloban and follow up. Mentoring needs follow up.
It's not a
Over
one-shot,
there. No,
one-time
no. We
deal,
just brushed
one-shot
it.
deal, no?
Yeah.
For sure. It's a process. No?
Yeah.
Butch, I mean, the process of recovery, I mean, psychological, emotional recovery, it's not just you can go you hold the session, that's it.
Yeah, well, actually, she's right. I know a lot of social workers who are training the lay people how to do mentoring, how to do PTSD debriefing. However, if there is no link between the one who has suffered and the one who's giving the mentoring, the communication might not be complete.
Yan. Kaya maganda yung grupo
This
nila.
is where INA really excels in because they have a link. The members have already felt it, as we have heard from the previous guests. The requirement is that
We'll lose a child.
Sana hindi na
child.
tayo sumali doon.
But that in itself is a
It's
gift.
a bond.
For sure.
Right now-
you can establish a bond
Yes, there's
easily.
you must be able to transmit what you want to portray to the child or to the mother, and that bond is really very important psychologically and emotionally.
Now, in your case, you're not from Leyte, you're not from the Visayan region. Are you, Dr. Brillantes? I mean, where does your family hail from? Are you from
I
Visayas?
live in Manila, in
Yeah.
Quezon City,
Yes.
but I really originally came from Zamboanga.
Okay, so down south. Now, okay, you went to Leyte. These are not your kababayans. You're not
Yes.
I assume you don't speak the same language. How did you have that bond with these Warais? I mean,
Fortunately for me, I married a Visayan-speaking Ilocano.
okay.
So I was able to, I was at an advantage because I knew how to speak Bisaya, which is similar to Waray.
Yes.
And when you listen, when they tell your story, their story, when you listen, it's like after interviewing like 7 mothers, I felt so hungry and tired.
For sure, drained.
Yeah, I was drained. But I was also happy because how many mothers can go and cry with them or share your story with them, or they
Yes.
I felt privileged.
Yes. How do you, and I asked this question of Mrs. Yulo and Mrs. Tan earlier, how do you maintain that strength to keep on, for not getting involved and feeling for the person you're talking to, but at the same time keeping that space for yourself, that at least you don't break down yourself and don't get drained yourself. How do you do it?
Oh, like it's like this. As Manay Gina was saying, no, when you help others heal, you get healed too. I mean, it works both
It's a
sides.
gift.
Yes.
Absolutely, absolutely.
Okay. Aside from, of course, you prepare yourself mentally by praying. You know, you don't absorb all the negative vibes. You know, you have to prepare yourself. If not, several. I've seen friends who volunteered a month there, coming back with, you know, stress.
Dermatitis.
Yeah, dermatitis, stress-induced dermatitis. Some were like kirat already when they come back. You know, even the press people, when they come interview people there, they needed psychological guidance.
No, for sure, for
after.
sure. Because this is trauma. I mean, I've talked to Butch, I've talked to many of his team members, I've talked to you ladies, I've talked to other people, and you know, you can't imagine the kind of devastation that happened there. I mean, you can imagine it, but it's so it's hard to put together in your mind exactly what went on. No, no. Now, ikaw, Butch, in your experience, I mean, I'm sure you've seen a lot of devastation, a lot of death, a lot of corpses, a lot of grieving families, all this, you know, all these things that we don't see in our daily lives. How do you and your team prepare yourselves for that kind of psychological
Well,
trauma on your part? Yeah.
Fortunately, I worked with an NGO way back during the initial years of my practice, and we centered on community work, and we were ready to go into a disaster zone, and we prepared ourselves by getting processed. We have to know ourselves. We have to know our limits. We have to know what we can give and what we cannot give. There has to be a mentor or a guide or guidance counselor who can help you discover yourself first before
Very
you
good
go
point.
in and offer your grief, grief with them, condole with them. Because if you don't know yourself, you'll be going into their depression.
Yes.
You yourself will go into the spiral of depression.
Yes.
And,
then it's
become a victim
counterproductive.
yourself,
No?
yes.
It's counterproductive. Now, kayo, Dr. Brillantes, how do you, in the INAO Foundation, I understand you guys, you ladies have training from the DSWD. Do you have any kind of these exercises that Dr. Ong was talking about? Like, you know, the
Yes,
sort of
yes.
self-examination and finding out
Yes.
where you stand, who you are, and, you know, because as he said,
Yes.
before you can help and mentor,
Yes,
you
we
also
need
have to
to
be
be-
grounded.
yes.
Do you ladies have
In
that kind of
fact, before we went to Tacloban, we had a one-day seminar for, you know, a preparation, a training, so that we don't delve on the cases where we cannot help. I mean, we have our limits.
What are those cases that you said are the cases that you cannot help in? What kind of cases were those?
Sometimes they give you example. A parent who lost a child and then there are nakakabit na problema. Sabihin, let's say the child was buried in a private cemetery and then she was asked for a fee wherein she doesn't have money and she's telling her story. I cannot help her in that aspect. Yung mga ganyan.
Difficult also no, when you're talking to someone who's grieving to somehow, sometimes you have to be cold and clinical as well. I mean, personally, you have to say, okay, as Mrs. Yula said, hanggang dito lang kami.
That's right.
And then,
That's right.
di ba,
Yeah, we were
difficult,
told
that's
to
difficult,
like
huh?
refer to some you know who could help them. But then in most cases, these mothers that lost their children and lost also their livelihood, their houses and everything, they didn't complain about losing their houses. They didn't complain about losing everything. They were talking about losing their child, losing their children,
What was
a loved one.
What was the most, the story that had the most impact for you, for all the people you talked to
There were two things that really struck me. A story of a mother. She had 6 children. The eldest was 7, and the youngest was an 8-month-old baby. And you know, water was coming up, and she had to make a choice to which one to save.
Wow.
And she let go of that 8-month-old baby
Wow.
just to save the 5 toddlers.
Yes, 5, it's a difficult choice, huh? Your baby or your 5 other children. Wow. I mean, how does one make a choice like that, no, Butch? Dr. Ong, how does one make a choice like that?
You don't,
I don't ever want to have to make a choice like that.
I don't want to make a
Yes,
choice.
Yes.
Yes. And how could she live psychologically thinking of that child to let go of her baby? I mean, for the
pain.
rest of her life.
How do you
Yes,
help
how do
someone
you
get
get
over that?
over?
I can't even begin to imagine how one gets over something
So
like
that's the
that.
gravity actually
Yes,
of
yes.
of what the victims have to deal with. Though. Of course, the ones who survive feel guilty because they survived.
Yes.
So you see, survivor's guilt.
Survivor's
Oh,
guilt,
yes.
no? Even if they had no hand in the death of their loved ones, they feel guilty because they're alive.
Mm.
And you have to deal. We have to deal with that, get them through it, and make them realize that they're still alive and life
Goes on.
Goes on, yeah.
Yeah. I understand, Butch, that although you guys are centered really on medical missions,
Yes.
that this is also a component
Yes.
to what you guys are doing, and that you guys are going to deploy soon. Is your group planning to address some of these, trauma, psychological, mental, emotional issues?
Yes, we have requested for social workers to come with us when we have our return mission, perhaps early February, back to Palampon. And this time we want to spread out to the neighboring municipality like Isabel.
Yes.
We already have a team of doctors and nurses going there. We still need to do some. We still need some social workers to come with us because we feel that it's an important or integral aspect of our recovery and rehabilitation efforts.
Bravo, bravo. Now, Mrs. Dr. Brillantes, Dr. Ong, unfortunately, we've come to the end of the show, and time goes by very fast. In fact, before you know it, 25 minutes, 30 minutes is gone, especially in the top end of this. But before we go, we have 1 minute to close. Last words from Dr. Brillantes first for our viewers.
To all the mothers that lost their children, it is not the end of the world. There is hope. You're not alone. We in INA would like to extend our help. We will be waiting for you if you need us.
Thank you very much, Madam. Dr. Ong?
Siyempre, kami ay nakikiramay din sa mga namatayan sa Yolanda, sa Samar, and in Leyte. Pero ang gusto namin talagang maibahagi sa lahat ng mga ating kababayan is that life goes on. And we must rise up. Kailangan bumangon tayo. At para sa ating mga pamilya din. And in order to do that, may mga tumutulong gaya ng INA Foundation, yung Coast Guard Auxiliary natin, yung Rescue 926. We will be going back to help you. But please, kailangan nilang lakasan ang loob nila at bumangon din sila sa sarili nila.
Very well said. Thank you very much, Dr. Ong. Maraming po salamat, and thank you very much, Dr. Brillantes. So guys, I hope you enjoyed our show today about the aftermath of Super Typhoon Yolanda. Join us again next year in the show where we talk about what matters to you, because you guys matter the most. I'll see you next week.